All right, thank you guys and appreciate your patience on this. So welcome today. My name is Tommy Ferguson and I'm the Executive Director of Capital City Village. Most of you know, but for those of you who don't, Capital City Village is a local nonprofit and we work with seniors in the community to help them age in place in the homes of their own choosing. And we do that through a blend of volunteer services as well as engaging programs. Many of those programs are social. A lot of them are informational, like the one we've got prepared today. So it is my pleasure to welcome Rob Faubion with Age of Central Texas. He is the Chief Community Engagement Officer for AGE and will speak on perceptions on aging in Central Texas, exploring attitudes and experiences of both older adults and family caregivers living in the 4-county region around Austin. Rob has been assisting numerous Central Texas nonprofit organizations for more than 35 years by helping shape their strategic plans, marketing and outreach efforts, client services, and community and media relations. He sits on the board of directors for the Life Park Center Taylor, the Senior Task Force for the City of Buda, and serves on the Aging Advisory Council of the Capital Area Council of Governments as the interim chair for Seniors and Law Together, SALT, and chairs the annual HIV and Aging Conference. So I'm really pleased to welcome Rob today. So Rob, I'm going to turn the presentation over to you. I would remind folks, please do stay muted during Rob's presentation. And again, there will be opportunity for some Q&A after his presentation. So Rob, go ahead and take it away.
Thank you so much, Tommy. Thank you everyone for joining us today. I really appreciate the opportunity to visit with you. Yes, I'm Rob Faubion with Age of Central Texas. For those of you who are not familiar with our organization, we are a regional nonprofit. We were born right here in Central Texas, a little more than 35 years ago. And we exist to help older adults and family caregivers to thrive. And we do that with 6 major programs over the 4-county region. Now, we are in the process of some major growth with our organization. We are getting ready to break ground on a brand new center in the South Austin area. We are also going to be renovating our historic campus that is in the middle of Austin. And we are then going to be building another brand new center in the Williamson County area. Before we embarked on this great fundraising adventure, we decided we better do our homework. And so we need to do some research to find out what exactly does the general public know about aging and caregiving. We had our assumptions, but we wanted to do some really in-depth research and find out what people actually know and understand about aging and about growing older and about caring for our older loved ones. So what I'm going to share with you today are some of the findings from that research. We did the research over a 4-county region of Williamson, Travis, Bastrop, and Hayes. And the responses represent all ages from 18 to, I believe, 104 was our oldest person who participated. We had a third party do this for us, and we asked them to make sure that we represented all ages, all demographics, all of the areas that we serve. So we could get a very good look at what the general public knows or doesn't know about aging. We found 2 things that were kind of surprising to us, and we'll discuss these a little bit more in depth as we go. But first was that the majority of people in Central Texas do not realize that Central Texas is the 2nd fastest growing area in the nation for older adults age 65 and older, and the fastest growing in the nation for those who are ages 50 to 64, the pre-retirement age. You put those 2 numbers together, and that means for the next 40 years, there will be more older adults in Central Texas than there are children, and there'll be more older adults than any other demographic. So that was a surprise that most people did not realize that. They had heard things like the silver tsunami is coming and terms like that that had been used, but did not realize that it was now. It's not something that's going to happen a few years from now. We're in it right now. The other surprise to us was that the majority of the general public could not name one single organization that serves older adults or family caregivers. And that was a surprise to us, that with as many of us as there are, both serving older adults and many of us that are older adults, that the general population did not know where to turn in the event that they needed some assistance. When we asked general public about their concerns of growing older in Central Texas, no big surprise here that the majority of people were worried about housing. We know that here in the Austin area, housing costs have gone up 22% in the past year. In the past 3 years, they've gone up 35%. So it's no big surprise that people are worried about not being able to afford to live here. And in fact, most people believe that older adults are going to be forced out of their homes. I'm preaching to the choir about this. We know how expensive it is to live in Austin. And even though you may own your home and have it paid for, that doesn't mean your taxes are not going to keep going up. And that is a big concern for a lot of people as well. I may own my home, but I'm on a fixed income and, my taxes are going up, but my Social Security is not. And so that is a big problem that people have, is that they get priced out of a home they already own because they can't continue to afford the taxes. Another big concern was running out of money. And we see that as a huge problem for a lot of folks. We know that older adults are living at home and living longer now than before. In fact, it is not unheard of to live to be 100 years old. Now, if you retire in your mid-60s and you've got enough money to last you 10 years, what happens after that? So that is one of the big concerns and a legitimate concern. Other concerns that people have had is not having family close by. Austin actually is one of the largest populations of solo agers in the nation. You think about people who moved here in their 40s and 50s for the jobs at Dell and Samsung and Texas Instruments back in the 80s. And now the kids have graduated college, they're gone, the spouse has passed away, and they're here by themselves. All of their friends and family are back in Michigan or California or Arizona, where they moved from. And they are aging here by themselves without a support network, which is why an organization like Capital City Village is so important for being able to age and be able to age successfully. They're worried about transportation. We have a lot of areas in Central Texas that are transportation deserts. In fact, you look at an area like Hutto, which is the fastest growing area in the nation per capita for older adults, and also the fastest growing per capita for older adults in poverty. So if you get forced out of your home or apartment here in Austin, and the closest place that you can find you can afford is somewhere like Hutto, that has no grocery store, has no hospital, only recently got a doctor's office, has no transportation, what do you do? So again, a very legitimate concern. People being worried about things like, if I sell my house, do I have enough money to go live somewhere else? That's a worry that I think we're all very familiar with. Food deserts in our area are quite prevalent, especially where older adults are living. I live out in Manor, and Manor has grown by 600% in the past 3 years. We have no grocery store. So you think about all the older adults that have moved out there where we have no access to food. You can go eat at Whataburger. We just got a Dairy Queen. But other than that, you're kind of stuck. So, again, things that are not big surprises, but are issues that we're having to deal with as communities. When we asked about your personal concerns as you grow older, no surprise that the physical decline is one major concern, uncertainty about the finances, and mental decline, things that we all deal with as human beings. But as we grow older, these are things that compound themselves, and they don't exist on their own. It's not, oh, look, I fell and I broke my arm. It's, I fell, I broke my arm, I can't drive, I can't get anywhere that I need to, I don't have a support system around me to help me. What am I going to do about getting food because I don't know how to use this app to order things to be delivered to my house? And so these issues compound themselves as we grow older. This was a little bit of a surprise to us on this statistic. We asked general population, are you now, or do you think you will be, a caregiver for an older adult? 11% of the population says, yes, I am, and 31% said, I know I will be. That in itself is not a surprise that 41% of our population is or will be caregivers. That's pretty close to what the national average is. What surprised us is how many people identified as being a caregiver or knowing that they will be a caregiver. So that's a very positive thing, that people are anticipating that they will be in a caregiving role and are looking for the resources prior or while they are in caregiving. Most people we know that are caregivers tend to try to go it by themselves and have a lot of difficulty in that process. And that's why organizations like Age of Central Texas exist, is to help in that journey. We were not surprised that 42% of the population said, no, I'm never going to be a caregiver. But surprise, surprise, I think we all know that, yes, you will be. We know that Rosalind Carter, when she left the White House, she started the Carter Institute for Caregiving in Georgia. She has a very famous statement that says that there are 4 kinds of people in the world. There is the person who is a caregiver now, the person who has been a caregiver, the person who will be a caregiver, and the person being cared for. And that is reality. We think about it. If we have children, we care for them. If we have a partner or a spouse, we care for them. When we get sick, someone kind of helped us, and we go back and forth between our caregiving roles. And so at some point, we all will be caregivers to some degree. And so it's good to know that at least the message of, if you're a caregiver, there's support systems for you, has resonated to some degree in the community. When we talk to caregivers specifically about their concerns, not surprisingly, they're worried about their person's physical decline. As caregivers, as our older loved ones grow older, there are more complications that come from age. And it can be concerning because we, as human beings, are really not trained in medical care for older adults. And so that's why things like the Caregiver Act of 2021 was so important, that AARP and other organizations helped push through federally, which, if you're not familiar with that, if you go to the hospital or to the doctor's office with a loved one who needs care once you leave there, the hospital, the rehab, the doctor's office is required now by law to teach you what you need to know in order to care for them when you go home. So if you're going to have to change the dressings on their wounds, they have to teach you how to do that. If you are going to have to give them specific medications or know about specific devices, they have to teach you about that. If you're going to be responsible for their rehab, they have to teach you how to do that. Now, this is a newer law, and a lot of medical professionals are not as familiar with it. So sometimes you do have to advocate for yourself and say, you need to teach me how to do that. But if push comes to shove, the law says they are now required to do that. So still, it's very worrisome. My father had a stroke 3 years ago, and now we're having issues with not only his cognitive, but also his cardiac. And we've had 2 operations. We're getting ready to do the 3rd one this Thursday. That's very difficult for my mother. And for me also, as their primary caregiver, that I'm having to take care of him, that he now has a stent and he has a pacemaker, and we're just about to go replace his heart valve. So his physical decline is a big concern for me as his caregiver. So I completely understand this statistic. Of course, we have the concern about the cognitive decline of our older family members as well. It's very hard to see someone start to lose their memory, to not remember things, to not understand things, to see that happen to someone that you love is very difficult, and it's very hard. I have a very good friend who is taking care of his mother at home, and his mother no longer recognizes him. She just thinks that he is a nice guy that helps her out. And that's very difficult when that happens. So I can understand this worry. And the loss of independence is also a big concern, because as a caregiver, that puts more burden on you of having to care for the person. But at the same time, you feel like your loved one is losing some of their dignity. And so, again, these are not surprising statistics, but they're things that we just don't think about that often. And to see them in black and white really kind of brings home what 40+% of our population is dealing with every single day. When we ask the caregiver, what is your worry about for yourself? Stress, certainly. Caregiving can be very difficult. Caregivers are worried about making good choices for the person they care for. And this is a human nature response. Am I making the right choice? Am I doing something wrong? Am I not doing the right thing? As an organization that serves caregivers, we always tell the caregiver, there really is not a right or a wrong decision. There's the one that you made with the information that you had at hand, and that was the right decision. You don't go back a year later and go, oh, if I had only known X, Y, Z. No, you didn't know, and that's fine. You made the decision that you made based on what you thought was the best care for the person that you love, and that was your right decision. Caregivers are worried about their own personal health. We've seen this through COVID as being an issue, that caregivers, we know, tend to forego their own personal care many times to care for the person that is their loved one. And with COVID, that became even a bigger issue. And, we have to tell caregivers, you've got to take care of yourself first. And that's not being selfish, that's being realistic. Because if something happens to you, then who is going to take care of your loved one? So it's the old adage of putting your oxygen mask on first. It's not being selfish, it's being realistic. And then finally, caregivers are worried about their own finances. And this is certainly a big concern, because with older adults living longer and needing more care, a lot of times people have not prepared for their own care financially. My mother is an exception, that she has long-term care insurance, and she got it when she was in her 40s. She's now 85. Yes, it was very expensive and continues to be expensive. However, I'm very grateful that she did that, because working for a nonprofit organization, I don't have a salary that can take care of her if something happens. And you look at the statistics of us living much longer, and we all know that at some point we're going to need care and assistance. It used to be that when someone went into a long-term care community, such as a nursing facility, a nursing community, the average time that they lived there was about 18 months. That was from admission to when you passed away. The reason was kind of twofold. One, we didn't live that long. And so once you got to the point that you went into the community, then you were pretty far along in your diagnosis. The other was that we kept our loved ones at home much longer than we do now. And that was because we had the family support systems around us. I was born on a ranch in Leander, and next door to our ranch was my grandparents' ranch, and on the other side was the great-grandparents' ranch, and then down the street were my aunts and uncles, and we all kind of lived in the immediate area. So if Aunt Irene fell and broke her arm, then we had the whole family right there to provide assistance. That doesn't exist anymore, for the most part. And with so many people who are solo aging, one trip to the hospital means you're now going to have to move into assisted living, because you can't stay at home by yourself safely anymore. And so that has caused a big change in the way that we care for older adults. And so back to the statement that it used to be 18 months. Now, when you move into a community, it's from 5 to 7 years. So let's think about this. We're moving into a memory community, which is out-of-pocket pay because it is not paid for by Medicare. Medicare doesn't pay for any of these things. Medicare pays for your medications. Medicaid will only pay for skilled nursing and only for a limited time. And the ability to get onto Medicaid is very difficult. You have to basically have no money at all. And there's a 5-year look back into your money. So it's not like I'm just going to give all the money to the kids and claim I have no money. No, they're going to look back and see how much money you had 1, 2, 3, 4 years ago. So moving into a memory community for 7 years at the average price of $7,500 per month in Austin. That's for a shared room out of your own pocket. Okay, who has that money? Yeah. So this is a very realistic concern about how do I pay for my continuing long-term care as I grow older? How do I pay for mom? And then if I'm going to use all of my savings and retirement to pay for my parents, what happens when I need it come 10, 15 years later? So very legitimate concerns here. Finally, we also asked about services that are available in the community. And this is that surprising statistic to us. We asked, is there an organization in your community that serves older adults? Most people said, oh, sure, yes, there is. We said, okay, name one. And they went, all right, you got me, I have no idea. Of the ones that could be named, AARP and Meals on Wheels came to the forefront. Well, yes, of course. You know, they're major organizations. They have multi-million-dollar advertising budgets. You see them on TV and billboards and in magazines. Certainly, those would be ones that would come to the top. Churches, yes, definitely. Places of worship have traditionally always been communities of social service as well. We're grateful that Age of Central Texas came up in the list. So as the marketing guy, I was doing something right there. But what surprised us is that nobody named the Alzheimer's Association or Family Elder Care, which has been here serving the Austin area as long as Age of Central Texas has. So we don't have a really good answer for why, other than we have a pretty good speculation. And that is that if you're not in the midst of your caregiving or looking for these resources actively, it's not top of mind. And so it's not something that you would automatically be able to spit out, oh, I know this organization does that. For example, if you asked me to name an organization that supports families of babies who have leukemia, I probably couldn't because I don't have a baby who has leukemia. At the same time, if I were not actively caregiving or I were not an older adult actively looking for social services to support me, I probably wouldn't know because it's not something that is part of my world right now. So that just puts the onus on organizations like ours to keep our visibility out there, because 187 people move to Austin every day. And if we look at the fact that 40% of our population are older adults and around additional 40% are caregiving as well, that's a lot of people who are coming to town brand new that don't know where anything is or who does what. And so we just have to keep putting our message out there that, hey, we're here when you need us. And when you need us, we'll be ready to help you. And that goes for all of the social service organizations in town. And then finally, we asked about ageism, because this is an area that's been of concern for Age of Central Texas for quite some time. Of the general population, ages 18 and up, we asked, do you think that there is ageism in Central Texas? 88% of the population said, you bet there is. We said, why? They said 2 reasons. Number one, the way the media portrays older adults is often negative. And number 2 is that our companies and our businesses do not see the value in their older workers like they should. And I know, again, I'm preaching to the choir about this one, but at least it's nice to see that the majority of our population, including our younger population, see this as an issue and see this as a problem. So we're not starting from scratch to address it. And during the past 3 or 4 years, Age of Central Texas has been working at the forefront of trying to fix this issue. The first thing that we've been doing is we've been working very heavily with our local media. And we've been training them in this issue that the way that they portray older adults filters down into the way that the entire society sees aging. That aging is not a negative, aging is a positive. That aging is not something to be scared of, and aging is not something to be made fun of. And so we're teaching them that their words matter. And we're teaching them to no longer use words like elderly because it has a negative connotation to it. We are older adults. We're teaching them that 40% of the population is older adults. And considering that as media, the majority of the people who are reading their newspaper and watching their newscast are older adults. So if you're insulting the person watching your newscast, they're not going to watch your newscast for very long. And your advertisers are going to be very upset with you. So we've been on a mission to make some changes, and we have seen some positive changes, but of course we have a long way to go on this. So it's good to know that things are happening. They're not happening as fast as I want them to, but we are addressing change. And finally, I just wanted to let you know that Age of Central Texas is here as your nonprofit to help serve you. As you are making your journey as we grow older, as you're helping care for loved ones, know that we're here to assist you in that journey whenever you need us. We have multiple programs across the 4-county area to help support, to uplift you, to provide you education, to help you find the resources that you need, and to help you to thrive no matter where you are in your journey. So thank you for the opportunity to share this information with you. If you've got any questions about that or anything else, I am ready. Lay them on me.
Oh gosh, Rob, thank you so much. That I'm a little overwhelmed from all the stuff, but that is really incredibly rich information. So thank you for doing that and getting that data, and also for sharing it with us too. There are some questions. There's one in the chat, and I think if you could just reiterate.
Sure.
So you studied a 4-county area. So if you could reiterate which
Correct.
ones those included.
Yes, so Age of Central Texas serves the 4-county area, currently 4-county area of Travis, Hayes, Williamson, and Bastrop. The reasoning for that is the St. David's Foundation is one of our major supporters, as they are of many of the nonprofits here in the Central Texas area. And our board decided quite some time ago that we currently would stick with those 4 counties because that's the 4 counties that St. David serves. And so in terms of grant reporting, it makes it easier for us to report our activities back out. However, we do know that the demographics have changed dramatically, and that there are a lot of older adults who are living down in the Lockhart area now, and out in Luling, and over in Marble Falls and Burnett, and in those areas. So we are planning to expand our services into those areas. Of course, all it takes is money and people. And so if we could do it tomorrow, we would, but it's going to be a measured growth for our organization. But we will continue to provide those services to where they are needed. Tom was asking about how we advertise or spread the word. That's a great question. We do have a limited budget as an organization, and so we get very creative in what we do. Social media has been a great blessing for us in that area because it is very inexpensive for us to utilize and has been very successful for us. So we do a lot with social media. We show up at every event that will invite us so that we can be in the community and be out there visible and get to meet people and explain who we are and what we do. And when I started here 8 years ago, I brought back our printed newsletter. And even though many people consider a printed newsletter to be kind of old-fashioned, old school, I did it purposefully. We put it out every quarter. It's also available electronically as well. But being that I'm an old advertising guy, you have the old saying that you want to have your product in front of the customer when they're ready to buy. Now, if you're Coca-Cola, that's easy. You just put a Coca-Cola machine on every corner and then, hey, I want a Coke, there's a machine, I buy one. But when you're a caregiver, how do you, as a business, find the caregiver when they decide, oh my gosh, I'm in over my head? Or if you're the caregiver, how do you find the service and the resource when you make that realization? So I started a quarterly newsletter that we now publish 20,000 copies of every quarter, and we distribute them at over 350 locations around Central Texas, including doctors' offices, at the neurologists. They're in the emergency rooms at the hospitals, at the senior centers, at the assisted living and memory connection communities around. Everywhere that I thought that a caregiver might be, where it dawns on them they need help, or they're looking for assistance, like at the churches. And so we deliver them to the churches where they might go saying, I need some help in this journey. Great, here's your resource that'll help you out. That has been very successful for us. And it is actually a fairly low cost way of help keeping us out in the community as well. So lots of guerrilla marketing to answer your question of how we advertise and spread the word. Plus, we have a lot of partnerships with other organizations like Capital City Village, who have been part of our world for many years. And one nice thing about this area is that we all as organizations want to work together. We're all on the same goal, which is to make Austin the best place in the nation to grow older. And so we all do refer to each other. We don't try to step on each other's toes. For example, we have the Thrive centers, which are our adult day health centers. And so other organizations, instead of trying to open adult day health centers, which are very expensive and very difficult, instead will refer to us. In the same way, we're not going to go off and do things that the Alzheimer's Association is doing, because they do them beautifully. And so instead we will refer to them because that's a better use of our money.
Exactly. And, you know, I often, when I talk to people about it, I often describe it as like we're part of a web of resources in the community. And so, you know, there is no one solution. There is no perfect, you know, one call away. But together we knit together a really supportive environment for people and the resources that they need. So you're right. Referring back and forth and over to other organizations has been, I found, just a great asset in our work, certainly.
It really is.
Go ahead. Yeah, I'm going to scan. I think Dr. McCourse has another question. And then if any other folks have a question, either raise your hand with the raise hand function or just wave and I'll scroll around and see if I can spot you.
I'm very old fashioned and wave, just like your newsletters are certainly have. Back to social media. What one or two do you feel are truly the most helpful in reaching the market you're trying to reach?
That's a great question. In my research and my experience of doing this here, the two that are most effective for us are Facebook and Twitter. We are starting to utilize Instagram for our fundraising because we need to start developing some younger donors. Like all organizations, as the organization ages, so does your donor base. And so in order to generate younger donors, we've started using Instagram, and that's been very successful for us. We've also been using TikTok. Our Thrive centers have actually been using TikTok to post videos of our members doing awesome, fun stuff. And so that has helped with our visibility. Now, whether it has helped with actually bringing folks to us who need our services, not really sure. But it's, all visibility for me is good visibility. And so helping to spread our message of look at this awesome stuff that our members are doing. And you know what, your mom, dad, husband, wife could be here doing this too is great. But as far as directly reaching the folks that we serve, Facebook, number one, has been our most effective, followed by Twitter.
That's awesome. Yeah, thank you for that tip too. Well, we haven't really ventured too much into Twitter, but I can certainly see where some of the other platforms would be helpful, especially as you do want to start reaching younger supporters. I believe Jeff and Luann Bowen have a question, if you want to unmute and ask.
I do. I help take care of two ladies that are in their mid-80s, and they both live at home together, but I cannot seem to get it across to doctors and rehab facilities and what have you, that they do not have cell phones. They do not have computer access, and they want everything done by email. They want appointments, they want follow-ups online, my charts, and they cannot do that. And I can't have my inbox and my phone just totally taken over by all of this. What's the solution there?
That's a great question. And honestly, I don't have a good solution for you. With our medical facilities, they've gone so full tech. And that was an issue that we ran into during COVID with a lot of people, that where telemedicine became basically the only way that you could see your doctor. And so many people who are rural do not have access. And so that became a big issue of how do you get medical support when you don't have the technology to do it. There is a program that Age piloted that we have applied for additional funding for, and we should know here soon, that we got funding and partnered with Austin Freenet to actually provide laptops and tablets for people who did not have them. And along with that came training on how to actually use them. It's one thing to say, here's your tablet, but it's another to actually, how do I use this? What does this thing do? So we did quite a bit of training on how you use it, how you protect yourself on it, because, here's my new plaything, but fraud is everywhere. So, don't give away all of your info on it. And also paid for the first 6 months of their access online. We've applied for quite a large grant partnering with the University of Texas to be able to continue this for 3 years and be able to provide the services for several hundred people. Have not heard back. We won't hear probably till the end of summer if we've got the money. We're very hopeful because of the partnership with UT that they actually wrote the grant for us, and they have a great track record of getting these grants. So that would be an opportunity that will come along. In the meantime, I think your best bet is to go to the doctor's office and sit down with the head nurse, not the person at the front desk. Ask for the head nurse and say, here's the reality. And, you're going to have to communicate with these folks a different way. You're going to have to call them on the telephone because they cannot access anything electronic, and it's not going to work. And if you actually have their health in mind, you will pick up the phone and you will call them. And that's the way you're going to have to do it. And make a note in their chart and in your records and in your database, this is how you have to communicate with this person.
Yeah, exactly. It's a good point. I'm going to scan here and just see if there are any other questions. If anybody wants to, I see Barbara Kaiser, if you want to unmute, and then we'll go Barbara Epstein.
Two things. I had trouble with the telehealth, and both my doctors agreed to telephone interviews in place of the telehealth. So what he suggests does work. It's worked for me. The other things I would say as a retired nurse is telehealth is not the answer for people who have very complicated health issues, lungs and heart, etc. There is no substitute for that.
Yeah.
And my other question was, I thought about it this morning when I was considering this subject. When people get the care in the house as they age, is that tax deductible at all in any way?
To my knowledge, yes and no. And again, I am not the expert on this, so do not go saying Rob said, because I'm not the expert. But I do know that medical care beyond a certain dollar amount is tax deductible, that you can get tax for it, and that long-term care is medical care. And so you can get tax, you can write some of it off on your taxes. Again, I am not the expert on this. And so I would definitely say, talk to somebody who knows this better than I do. Right now, the United Way, because we are in the middle of tax season, the United Way has free tax assistance for older adults. So you can just search for United Way or call up to our Caregiver Resource Center if you're not savvy online, and they can connect you up to it. But the United Way, or better than that, call 311 because it's run by the United Way. Call 311 and say that you need to be connected to the United Way tax folks. And they have volunteer tax experts that will actually do your whole tax return for you. And they would be your best advice right now to get those kind of answers, because they've got the whole bank of folks ready and willing up until tax day to help out. So that would be my best bet. Call 311, ask for the United Way's tax assistance, and they'll answer your question.
So we'll go now to Barbara Epstein, if you want to go ahead and.
I just wanted to add a point about dealing with doctors' offices, which is given how I guess the best word is how convoluted offices can be these days, that the best thing would be to call a doctor's office manager to get a hold of them, because they're going to deal with every aspect of the office and how it works. The other thing I would say, aside from the fact that Bob and I probably need to have a chat, is that in dealing with seniors in my law practice, I would say it's a really bad idea to try to get people who are not computer savvy using them, because there is so much fraud out there right now. A lot of communities have created, and I'm talking not only in the United States, but worldwide, have created consortiums where university students help seniors do things. But I think that in my experience, seniors who are not computer savvy have a hard time learning it, have a hard time adopting it, and it just does not work very well. And again, doctors' office managers will call the shots on how something gets done in an office. The other thing that hasn't been mentioned here is the Area Agency on Aging. Their staff, every county in the country has an office. Their staff deal with not only benefits, but all the resources available to seniors. They help people sign up for services for free. And they have ombudsmen who deal with assisted living and nursing home issues. And again, this is a free public service. They're underutilized, unknown to most of the public, and they know what they're doing, and they're not marketing anything. So I think that they're a very, very good resource for seniors that people don't know about. And here in Austin, of course, we've got family elder care, and they may have a service already dealing with computer issues.
That's a great point on Area Agency on Aging. For those who are not familiar, the Area Agencies on Aging are your pass-through money of the Older Americans Act. And so basically your taxes have already paid for the services. And the local one is the Area Agency on Aging of the capital area. and they serve a 9-county region with tremendous services. And so they definitely should be one of your first calls for service.
Yeah, here, absolutely. I second that one. Sue, I believe you've raised your hand.
Yes, I agree with all the solutions you have come up with, Rob and Barbara and the other Barbara. One thing we have found is it's time intensive and training intensive is that idea of the liaison or the medical advocate who actually goes with the person to the appointment, takes the notes, helps the communication with the office when the person can't follow through appropriately, correctly, due to whatever reason. And that works, but that's takes a volunteer for every person who needs that. So are there other training programs for that other than what we're doing at Capital City Village?
Not to my knowledge. Of course, there are professionals that you can pay that will do it as well, but on a volunteer basis, not that I know of.
Yeah, good point.
Okay.
Yeah, and that is, of course, that is one of the services that Capital City Village does offer when it's appropriate and when it's the right thing, a good fit for the person. But yeah, it's certainly been helpful. I've shared experiences of my own like that. One of the things, and I think because we do have some time here, Rob, I think I wanted to catch you and just give you an opportunity to share with, unless there are other questions, and I'll scan quickly, but I wanted you to tell us a little bit about what Age of Central Texas is up to in the near future and sort of a little bit longer range plans. And I'd like to also take the opportunity to remind folks, ageofcentraltx.org is the website. So you can get a lot more information there. If you're interested more about Capital City Village, that's capitalcityvillage.org. So, but please do, Rob, tell us what's coming down the pipe for Age.
Sure, we're very excited. Age has been around for 35 years. And about 10 years ago, our board realized a lot of these statistics that we shared today, and in particular about the growth of the community and how so many more older adults either were moving to the Central Texas area or how our population was naturally aging to the point where 40% of our population are older adults. So we realized that we needed to get ahead of the curve, and otherwise we would always be playing catch up with services. So we started on a very intense, comprehensive plan of where we wanted to be and how we could best serve the community as it grew. And we decided that the best thing that we needed to do was we needed to branch out of our one central facility, and we needed to build more centers in Central Texas to serve the community. So in June, we are going to break ground on our South Center that will be located in South Austin in South Park Meadows. It will be right behind the Target, sitting on beautiful 2 acres covered in live oaks. And we're building a brand new center that will have a Thrive Social and Wellness Center that will be licensed for 75. It will be brand new, designed for dementia care for older adults. We've been researching for years on, if we could build a new one, what would it look like? And now we have the opportunity to do it. We're super excited. Plus, all of our other programs will be located there as well. Our health appointment lending program will be there. Our navigation center will be there. We'll also have space where we'll be offering classes and workshops. We will also have shared space for our partners in the community as well. So there will be opportunities for other organizations and nonprofits to have office space at the center. We're in talks with Meals on Wheels to be a distribution center for the South area as well. All kinds of amazing things that will allow us to better serve the South area of Central Texas, down into Buda and Kyle, over into Bastrop, into Dripping Springs and Wimberley. And then we were going to renovate our historic campus that's here in Central Austin. It was built in 1906 and has been held together with duct tape, dust, and ghosts. And so it's time to do some repairs and work. because it is a historic building, it will take a little bit longer because there are things that we cannot do physically, but we need to replace all the infrastructure internally. And so we will do that so that we will continue utilizing this space as well. And then we're going to build another brand new center in the north area up in Williamson County. We currently have a Thrive Social and Wellness Center there in Round Rock that serves the Wilco area, but we are landlocked where we are because we rent and we can't grow any bigger. And so we are going to build a brand new center. Basically, now that we have the blueprints for one south, we'll just get some land and build the exact same thing up north. And we're very excited that between these three big pieces of growth, we are basically going to triple the size of our organization.
Wow, that is incredible. That is really great news.
It's-
So yeah,
it's
so
exciting and
happy to hear
scary.
that. That is exciting. Wow. And so, yeah, so that's going to start as of June on Breaking Ground South, and
Yes,
then just a matter of time before you move to the expanded opportunities north.
Yeah,
Well,
we'll break ground that first week in June. Public announcement will be coming very soon. And it's anticipated it'll take us about 9 months to complete the construction because we've done a lot of the work beforehand and gotten all of the clearance with the city. We've gotten all of our permits. Everything's been done. We are shovel ready to go.
that's great. Wow, that is such good news. All right, I'm going to scan one more time just to see if there are any other questions. And if not, then I guess we will just say thank you so much, Rob.
I have a question.
Oh, one more from Barbara. Go ahead.
Yeah, I have a question. What is your sense of the transit needs of the people that you interact with, the seniors? Do they need to be able to make trips on the spur of the moment? Would they benefit from having circulator buses in their neighborhood to go to the grocery or the drugstore? Do they want door-to-door service?
That is a great question. And from my experience, the ride on call is the most important for folks right now. So a service like Uber or Lyft is most important, but of course, many older adults don't know how to use that service or are not comfortable with it. So we've been working with the cities that we serve to help them understand that the circulator buses, although a great idea, are not getting great ridership. And so if they can convert those into call on demand, instead, they're going to get a lot more readership. We did this in Taylor with carts. And if you're familiar with carts, they are the rural version of Capital Metro. So like if I'm living in Taylor and I need to go to Austin, I can take carts and I can get on the bus and it'll go a couple times a day to wherever I need and make my stops. And so I just kind of like the train is. If I live out in Leander and I'm going to take the train into Austin, it runs on certain times and then I take it back. Same kind of idea. Well, carts had also started doing the circulator buses and they would run, their daily cycle and round. Well, the problem was that most people couldn't get to where it was. So yeah, that's great that I could ride it, but I can't get to where it picks up. So that doesn't do me any good. And it's not going to go at a time when I need to go, and it's not going to go where I need to go. I need to go to my doctor's office over here. I don't need to go to the Walmart over here. So the ridership was very low. And so we convinced carts to try doing the on-demand, and it went up 500%. And they went, this is such better use of our time. So that worked beautifully out in Bastrop and Taylor. So they're working on doing the same thing in Manor. With Capital Metro and potentially adding that as an opportunity here in the Austin area. We do have Metro Access, but Metro Access is primarily for folks who cannot use regular Capital Metro, either because they have a handicap issue or cognitive issue, makes it difficult for them to ride on it. We use it a lot with our Thrive Social and Wellness Centers to bring members to the day center and take them home at the end of the day. There is a process for signing up for it. You have to qualify for it. You have to jump through a few hoops and fill out some paperwork. But it is a tremendously good service. And you call in advance and set up your ride for when you need it.
Okay, well, but are they say that they have a senior service now, and it serves 11 areas. The only one that's in town is Terrytown. And I just was wondering if you have had any contact with that. It's a senior ride service, but it isn't whole zip codes. And I'm trying to get them to explain to me how they picked what they set up.
Yeah, and that one is a service that's coming to town. It is a for-profit. And so they are growing as they go. However, I do know that Lyft for sure, Ride, I don't think is still around, unfortunately, but Lyft does have a special rate for older adults, and you just ask for it. And so they provide a special rate for door to door, specifically for older adults.
Well, this is interesting. I'm supposed to be talking to the planning director on Friday, and to tell him that it's never been presented to me that this senior van service is a for-profit operation, but they can't explain how they devised it. So this will be good feedback to give them.
Yeah, and again, as older adults, we have to advocate for things for ourselves. It's not going to be handed to us if we don't say this is a problem. And many people who are the decision makers don't know the stuff that we know. They don't know these statistics. They don't know what it's like to be an older person who has limitations and needs some assistance. And so we have to advocate for ourselves and say, the system as it exists doesn't quite work that well. What we really need is ABCD, and at least get the ball rolling to those who are the decision makers to know this is what we really need in order to be able to thrive and be a wonderful part, continue to be an active part of the community.
Yeah, hear, hear, absolutely. Well, we're so glad that you were able to share the good news with us and a lot of really great information and resources. And I really do hope that you'll let us know as the groundbreaking comes closer. I think we'd love to help promote that and get the word out too. But thank you, Rob, so much for all of the good information today and just for sharing your time. Thank you so much. We'd love to have you back for more.
Sure.
So maybe when we can line that up, that would be a good thing to do. But yes, keep us posted and best of luck because you guys are doing such great work. Huge fans.
And thank you so much for the opportunity to visit with you. Great to see people that I know here today. It's really wonderful. And just want to leave you with the one reminder, and I have to tell myself this all the time as a caregiver and older adult myself, there is never, ever any shame in asking for help because every one of us at some point in our life need it. And that's why organizations like Capital City Village, like Area Agency on Aging, like Age of Central Texas, that's why we're here, is to provide that help when you need it. And so there's never any shame in saying, I could use some help. And that's why we're here when you need us.
That's right, 100%. All right, folks, thank you so much for being with us this afternoon. And Rob, I'll stay in touch, but we want to line something else up again very soon and hear more about the groundbreaking. Wonderful. All right, thanks everyone. Appreciate your time today.
Thank you.
All righty, bye-bye.
Bye.